Tuberculosis, or TB, is a major health crisis in Papua New Guinea, which has increased an eightfold since 2008, with an incidence of 432 per 100,000 people, and it calls for an intervention. In 2025, the country recorded over 51,000 tuberculosis cases, of which 723 cases were recorded with the multi-drug resistant TB or MDR TB, and this is also rising rapidly. TB is not a problem that can be overlooked. It is destroying families and communities across the country. With cases rising each year, other factors like the treatment challenges, stigma, and discrimination that poison the communities, family responsibility cause people living with the disease to neglect their health. Dr. Margaret Kal, a senior technical officer responsible for the tuberculosis program with the Disease Control Division of the National Department of Health, whilst stressing the threat being real, she stated multi-drug resistant TB or MDR TB is rising in PNG.
But drug-resistant TB happens when the drugs, we call them the first-line drugs, the drugs that we use to treat TB do not respond to that TB, so they become resistant, and the resistance comes around because when people are sick, they take the medicine, but they're not regularly taking it, or they're not faithfully taking it, so that results in the bacteria become resistant to the drugs. And then if someone has that type of TB and spreads, then and you are exposed to that, then you can get that drug-resistant TB. The challenges around drug-resistant TB is that it's very hard to treat. That is why it's a challenge in itself, and the drugs that we use to treat, they're very expensive as well, and if you do take them, they're also toxic, meaning that sometimes they can make you feel unwell, sick, so that is why it's very challenging. And we have seen that in PNG, TB is actually increasing. So when TB increases, the drug-resistant TB is a form of TB anyway, so it increases as well. So it can be easily transmitted. That is why it's very challenging.
You've mentioned challenges. MDR TB treatment is tough and can last from 9 to 24 months. However, patients face severe side effects from the drugs. In Port Moresby, studies show 22% of MDR patients never even start treatment, and this is a big risk.
Just for the usual TB, it will normally take 6 months of someone taking medicine every single day for the person to be successfully treated. For the drug-resistant TB, traditionally, I mean like maybe 1 or 2 years ago, what we were doing is that you will be taking treatment for at least 24 months, 18 to 24 months, and first 6 of those months you'll be taking injection every day. So that is very challenging for patients to endure that type of treatment. But now we have treatment that are shorter regimen with a lot of different drugs that are combined together to give the best possible response for this drug-resistant TB. So now patients can take up to 6 to 9 months, sometimes 6 to 9 to 11 months. But in PNG, we now have treatment that people can take up to 6 months. But most of these drugs that are used to treat the resistant forms of TB, they are being toxic in the sense that when you take them, you can feel sick as well. Some drugs can cause you to have deafness as well. Or when patients are taking it, can have side effects, unlike the drugs that are used to treat the usual TB. So that is why taking treatment itself is challenging. Nutrition is also good. You need to actually eat good food before you take treatment. And also family support is also critical.
While treatment itself presents challenges, Stigma and discrimination are far more destructive. They can kill. For many people living with tuberculosis, the weight of stigma brings shame, and this deeply affects their ability to take daily medication. When treatment is interrupted, the risk of transmission grows, spreading tuberculosis further within the communities. Addressing stigma is therefore not just a matter of dignity, it is a vital step in breaking the cycle of infection and saving lives.
We're experiencing a lot of stigma around TB. So stigma, to start with, is the negative labeling of someone who has TB. Maybe it's out of fear. Most people fear that TB is an infection that can probably make cause them to die. Or some people have maybe poor language around, understanding around TB, the cause of TB. They could say that it's associated to sorcery, maybe some traditional belief or cultural belief, whatever bad information they have around TB. It causes them to have a fear around TB that if I get TB, I'll die, or if I stay close to someone who has TB, that person will give me TB and I'll die, so I'll probably avoid. So because of this poor information or knowledge around TB and other issues around TB, that try to give a negative labeling, that stigmatizing people with TB, and as a result, they take action. Sometimes it's discriminatory in cases where families might chase away people with TB. If someone comes home with the diagnosis of TB, they might be already telling them, you can't sleep in the same house with us, you can't be sharing the plates, so you can't be eating the same table. So it's happening across the country, actually in all the provinces, and we encountered that. So because of that, most people have a fear of going to the hospital to get a diagnosis of TB. Or sometimes when they do get a diagnosis of TB, they don't go and tell their relatives that they have TB. They try to keep it within themselves. And then sometimes they don't take the treatment. As a result, the treatment process is affected. So for TB, whether it's the sensitive form of TB or the resistant forms of TB, you have to take your treatment faithfully for every single day until the full duration to be successfully treated. But if you stop in the middle because of all this stigma related TB, then it will lead to either drug resistant, or you might become more sick and you can actually die as well.
The National Department of Health is committed to reducing the burden of tuberculosis in the country. Through the introduction of advanced screening technologies, individuals can now be tested more efficiently with results available in a shorter period of time. Dr. Kal has explained how these innovative devices operate and how they are proving vital in detecting tuberculosis at its early stages. This progress marks a significant step forward in the fight against the disease.
The tools that we have, they're actually, you can bring them to the point of care in the communities. So we recently have launched X-ray, portable X-ray that has inbuilt AI for reading the X-ray as well. So when someone takes an X-ray and then it goes through the AI, it can give you some reading that says it's more likely to have TB or not likely to have TB. Then you can go for investigation. And with that type of equipment and mobile kit, we also have latest tools called Gene Expert as well. So these ones, they will give you the result for TB within 2 hours. Previously, you'll probably give your sputum, then come back after 2 days, probably after 5 days to check for your result. But with these tools, you get screened today, get the X-ray today, submit your sputum. In 2 hours, you should have a result that says whether you have TB or not TB. And if you have TB, then it's linked to a treatment process. So you can actually get treatment on the same day and then follow up with the treatment.
Tuberculosis and multi-drug resistant tuberculosis are both curable. With the support of advanced technologies, mobile testing now places solutions within the nation's reach, literally at our fingertips.
My message to everyone in PNG is this is the right time we have to stand up and take action against TB. TB affects us. TB exists in human beings. Human beings transmit TB. TB lives with us in our communities, in our houses, in our homes. If you go to the buses, TB is there. If you go to the shop, TB is there. So the most common type of TB that spread, we normally call it market TB. It's everybody's business. You spread, you take it. You cannot categorize it. You cannot blame it on another person. It is everybody's responsibility. So it is up to all of us to take action. If you are a leader, you need to take action, be committed. If you can, you are responsible resources, commit resources to your nearest health facility, your community, to provide the best treatment, diagnosis. The tools that we just mentioned, they are available, but it cannot be available all over the country. It needs investment to bring them into. So we are like, it's a call to all the our leaders who are in a position to make decisions and invest resources. We should be able to make the right decision, the right commitment to bring all these tools to the most nearest community. And to every one of us, we need to stand together to support people access treatment. We need to spread this information about TB. TB is treatable, it's preventable, it's curable. We do not have to stigmatize it, label it, because you cannot label human beings. It's part of us, but if we act together, we can actually address it, we can actually stop it. Health workers are there to help, but communities need to work together with health workers, the health system, and we have to support people to access treatment. You can just by telling somebody about TB, you can actually save their lives as well and commit to reducing TB in the country.
Yet these achievements cannot be realized without the commitment of every individual in Papua New Guinea. Communities, individuals and leaders alike must stand together. Each has an essential role to play in bringing an end to the fight against tuberculosis.